Hi, doctor. Last fall I was diagnosed with PAD and I had an angioplasty in both legs. Um, the doctor opened up blockages in my thighs and also below the knee. So since then, the below the knee has stayed open, but my thighs have blocked again. And I'm kind of an unusual case because I have no risk factors at all. Right now, my LDL is 30 and my HDL is 46. Um, so I'm kind of on the fence on whether I want to get stents put in. And I'm curious, like, my right ABI is zero point 0.8, my left ABI is 0.71. I'm on the fence on whether I should just kind of walk through this pain and build more peripherals, or should I go for a stent? I'm kind of worried that that's opening up a Pandora's box of repeat stenting.
Yeah, well, Darlene, that's a great question. It's
Yeah.
something that confronts folks every day. What to do, when to do it, why to do it. It sounds like, and I don't, again, want to give out medical advice. It's not the right forum. It sounds like you're having claudication. Is that accurate? Your
Yes.
legs hurt when you walk? Okay.
Yes.
Now, this is what I was talking about with Kim. It becomes a very nuanced discussion, a very detailed discussion with whoever's going to do any sort of procedure on you. What benefit do you stand to gain? And I would encourage you to talk to more than one doctor about this. I think
Okay.
getting a second opinion is very important. Uh, Doing things like walking more in the interim, always good. And when I say walking again, back to that discussion about surfing or mountain climbing or karate, whichever gets your legs moving. Um, and then, you brought up your risk factors. The classic risk factors for peripheral arterial disease are, like you said, high cholesterol, but then there's also high blood pressure, smoking, um, diabetes, and kidney disease. Those are the big ones. And I see you shaking your head. So if you have
I
none
have
of
none of
those,
those. None of
oh,
those. No.
that's good. I mean, it means your prognosis is probably better than the person that does have those troubles. Um, but again, talk to somebody else maybe. I'm
Okay.
sure Tim is a great resource. You have navigators that can help you with any sort of challenge associated with finding somebody to talk to you about this in your local region.
Yeah, our philosophy always, especially with a high, at the higher end on the ABI, is walking is the best medicine, and we do have our walking program, and we do have walking materials that we can send you. If you email me, or I can KYM at thewaytomyheart.org, KYM at
Okay.
thewaytomyheart.org. They can put it in the chat as well. Email me, and then I can email you some great resources. Dr. Anita Dua, who's a vascular surgeon, she's on our board of directors. She's with Mass General, and she put together a great video on how to walk effectively to grow those collateral vessels and to improve your claudication in a very short time. And we do have our walking program that it will help you to track your steps and your improvement in walking over the course of a few months. But I agree with Dr. Sarkowski. You always should, everybody should have a couple of different doctors in the back pocket to weigh all of your different options. And especially if they're talking stents, the two of us were talking about the less is more approach, a leave nothing behind. And if a doctor is automatically saying to you, hey, we're just going to go in and place stents, that's not the right approach for anyone, unless it's definitely in the heart or in the abdomen. Even the iliac arteries are usually a guaranteed stenting if in fact they go in. But with the newer technology like lithotripsy, they're using stents even there less and less. Or is it still always stenting in the iliacs if they go in?
Yeah, another new technology for our friends that were interested in technology. Intravascular lithotripsy has become a very important part of our armamentarium when we're treating vascular disease. And the concept here is that it basically dissolves the calcium or makes it a particulate rather than a rigid rock, and gives a lot of that lumen back for blood flow. And so that is, yes, something that people are doing without stenting in the iliacs. I will tell you that it is another below the knee option. I have several patients that I've treated below the knee with Shockwave, and that's worked well for those folks. I know that there's a second company that's coming out with technology for intravascular lithotripsy, and they are not yet to market, but hope to be soon. I think they're undergoing their 20 center clinical trial to prove efficacy.
Yep. And so there's also and I'm just curious from your perspective, when I talk to patients about, when they say that they don't have any sort of risk factors, I always ask about, well, what have they figured out the morphology of the plaque? Is it rock hard calcium, or is it clot? Because if it's something that's clot, you're considered more hypercoagulable versus necessarily peripheral arterial disease.
Yeah.
Kind of what Deion Sanders, Coach Prime, the former NFL football player, now college football coach, he's considered more hypercoagulable because of clots. Now, there are a lot of ways in which you can become hypercoagulable. It could be a genetic risk factor for a clotting disorder. You might have AFib. I don't know if you've ever had your heart checked for AFib, or for valvular issues, or even
my heart is totally
aneurysm.
clean. My heart is totally clean. I had all the heart tests. This is only happening below the waist.
And so, do they know if it's blood clot, or if it's
it's strictly plaque. The doctor who routed me said it was all plaque.
Oh, so he's already been in there.
Yes, I had an angioplasty, but I had angioplasty last fall, and the lower part below the knee is still open, but I'm blocked again in my thighs at the same spot where she had to really kind of chisel away because I was like 100% blocked.
Oh, but now you have a pretty high ABI at the moment, so you must be walking.
I have a lot of collaterals because I used to walk a lot before, and so
yes.
Yeah, I mean, my ABI is pretty high for somebody who's as blocked as I am. And is that a dangerous thing to be like walking around with a blocked main artery like that? I can't hear you.
Is this a mute button?
Yeah.
Okay.
All right, now I think we're okay. How about now?
Yeah.
Can you hear me now? Okay, wonderful. Yeah, so people do often wonder if walking with a blockage is a dangerous thing. And I would say, do what your body tells you.
Yeah.
When your body tells you, oh my gosh, it hurts, stop, take a rest. That's the classic description of claudication. So no, to answer your question.
Okay. Thank you so much.
You're welcome.
You're welcome.